Hi everybody, welcome back. Ex-Phys Guy here, and today I want to talk to you about clinical exercise physiology as a profession in the field of exercise science. In some recent videos, we've discussed personal training, introductions to things like strength and conditioning, and exercise physiology. Now, one of the fields that I think is really important to talk about is clinical exercise physiology, because I think it is a field that is very young and growing, but also may at times have some confusion involved with it. A lot of people will come up to me and they'll ask, well, what is a clinical exercise physiologist? What do they do? And if I was to give sort of a textbook definition, I would say that a clinical exercise physiologist is a healthcare professional that works in either a hospital or outpatient clinical setting, university research setting. And what they do is we use things like exercise, education, behavior modification, and lifestyle modification to treat chronic diseases and to act as secondary prevention for chronic diseases such as cardiovascular, pulmonary disease, metabolic disease such as kidney disease or diabetes. And we take information from basic physical assessments with listening to heart sounds, checking for pedal edemas, blood pressures, things like that. If a person has had a stress test in the past, we'll look at that information, 12-lead EKGs, and we'll use all that information to create a safe and effective exercise program, but also just sort of lifestyle modification program. We'll look at the areas that need help. Do we need help with weight loss, or do we need to understand nutrition a little better, or do we need to understand why I have diabetes and how can I make it better? So a clinical exercise physiologist is a really important part of the healthcare system because we offer education and guidance and tools that don't involve things like medication or really intensive or invasive procedures to help with lifestyle modification. Now, if you're a young student and you're thinking, well, how do I get into clinical exercise physiology? I want to be in the clinical field. I want to be in the healthcare providing field. I want to be, working with these patients who are high risk and have diagnosed disease and are working to really get themselves better. So it used to be that you needed a master's degree in order to sit for the exam to become certified. However, in 2017, the American College of Sports Medicine made a change they made a couple changes to their certifications and their requirements for taking those certifications. That information can be found on their website, but I'll try to put some of it up as I go as well. As of 2017, all students taking the exams now do not need a master's degree, but you will need a degree in exercise science or exercise physiology or a closely related field, and you will also need a certain number of documented clinical hours. And this is where it gets a little confusing. If you have a bachelor's degree, you will need 1,200 documented clinical hours, either in a cardiac rehab setting, a physical therapy setting. Or you can split up your hours however you like. You can go to a kidney treatment center where they exercise individuals while they're on dialysis. You can go to a diabetes specialty center where they exercise and use lifestyle modification on those folks. If you have a master's degree in clinical exercise physiology, or a related field, then you will only need 600 hours of documented hours. So that's the major difference there. So sometimes, students, ever since this change, will come to me and say, well, why should I bother getting a master's now if I don't need it? There are some advantages to that. I don't want to stray too much, but there are some advantages, such as you might have the ability to be a little bit more in a leadership role, or if you're interested in the research area of it, you'll be better fit for that. But you'll be perfectly suited as a clinician and maybe even a manager as well when you have that extra level of education, under your belt. I have the information in front of me here. You can go to the ACSM website and it lays out everything you need. But basically your biggest difference between your exercise physiologist and your clinical exercise physiologist is going to be how they approach the treatment of their patients, because a clinical exercise physiologist is definitely going to be working with some high risk clinical populations where these people have multiple comorbidities. They'll have cardiovascular disease, they'll probably have diabetes as well, and they'll need some lifestyle modification in some other areas where, we all do, but a clinical exercise physiologist will really approach it in a full clinical view. They'll listen to your heart and lungs if they need to, they'll check for pity and ankle edema if they need to, and they'll be able to advise you on what is the safest and most effective route as far as exercise and nutrition and behavior modification to be able to help yourself the most. For example, I myself have a kidney condition. So being a physiologist, I can say, an exercise physiologist who focuses in clinical, I can say, all right, I know what are some safe and effective measures for my kidneys in the exercise and lifestyle modification realm. So that is going to be the biggest difference between your exercise physiologist and your clinical exercise physiologist. An exercise physiologist really is not fully certified and not a great fit to work in a fully clinical setting. If you're an employer or you're a student and you either need or want to be in the clinical setting, my guidance is to strive for that clinical certification, so that we can further the field, we can get qualified professionals in the positions where they need to be, we can keep our patients safe and we can keep their programs effective, and we can really help grow the profession and help our patients, ourselves, and the general population to understand where an exercise physiologist fits in and where a clinical exercise physiologist fits in the healthcare and wellness fields. So your exercise physiologist is going to be a health and fitness professional who will be able to run exercise tests on you, interpret them, use them to create safe and effective exercise. Your clinical exercise physiologist is going to be very well educated and very well versed in clinical populations such as heart disease, lung disease, kidney disease, metabolic disease, cancer, hematological conditions such as anemia and other things. And they'll be able to look at all of your clinical information, your medical history, your family history. They'll look at the medications that you're on and see if there's anything that we need to take into account for or be careful for when we exercise, because medications can alter our physiology. So we have to make sure that the individual who's exercising, you or us, knows what the effects of those medications are. So I hope that this was a good explanation and breakdown of what a clinical exercise physiologist does and the steps that you need to take to become one. You will need minimum a bachelor's degree with 1,200 hours of clinical service, documented hours, or a master's degree in clinical exercise physiology or another closely related field with 600 hours. I have an idea to do a backup video to this one as well to further break down the differences, but for now I just wanted to give everyone kind of an introduction and definition to them. Thanks for watching. Don't forget to comment below, add some ideas for videos that you'd like to see or discussions that you'd like to see in the future. Bye.